Welcome back, my students. Dr. Oogway here, and today I bring you the playlist of the spinal cord. Clearly, there's the chapter third from Brain Neuroanatomy series of BDC. Video first of this playlist, we will study spinal cord under 7 headings. These are its 7 headings. Number first heading is Introduction and its features. So let's begin. Number first, what is spinal cord? Spinal cord is a long cylindrical structure. Long cylindrical structure. Clearly, of long cylindrical structure of CNS, which joins brain to peripheral nervous system. So what is spinal cord? It is a long cylindrical structure of CNS which connects brain to a peripheral nervous system. That's the number first point. Number second point, in spinal cord, clearly it superiorly superiorly it is continuous as medulla oblongata, clearly, and inferiorly it terminates as conus medullaris, clearly. If we say this is a spinal cord, this is a spinal cord, long cylindrical structure, it joins central nervous system, it joins brain with peripheral nervous system. Superiorly it is continuous with middle oblongata, so this is middle oblongata, and inferiorly it terminates as conus medullaris, so this is spinal cord. So these are the 2 points in introduction. Moving on to the third point of the spinal cord, clearly we know this spinal cord, it is present inside vertebral column, present in vertebral column. Clearly spinal cord is present in vertebral column. This vertebral column, if we talk about vertebral column, clearly it has 33 vertebrae: 7 cervical, 12 thoracic, 5 lumbar, clearly 5 sacral, and 4 coccygeal. 4 coccygeal. Usually sacrum and coccygeal, these 9 vertebrae are fused. Clearly, these 5 are fused, these 4 are fused. This is the vertebral column. Clearly, with 33 vertebrae. This spinal cord is present inside vertebral column, but this spinal cord occupies upper two-third of vertebral column. Upper two-third of vertebral column. Clearly, and spinal cord is surrounded by three meningeal layers, three meningeal layers like brain, three meningeal layers like brain, clearly. So what is spinal cord? It is a long cylindrical structure, superiorly has middle oblongata, inferiorly conus medullaris. It is present in vertebral column. Now we will talk about the extent of the vertebral column. This we will talk about the extent of the spinal cord. This spinal cord extends from C1, that is here C1 cervical vertebra, to the L1 vertebra, to the lower border of L1 vertebra. So this spinal cord extends from C1 to the L1 in adults. In newborns, it extends from C1 to the upper border of L3 vertebra. Clearly, in newborns. So this is the extent of spinal cord in adults and the extent of spinal cord in newborns. So it's a question: spinal cord ends at the level of L1 in adults and ends at the level of L3 in newborns. Clearly, after 2 years, two years, after 2 years, clearly, uh, it reaches adult level. Newborn, it reaches adult level, that is L3 to L1, after 2 years of birth. After 2 years it reaches adult level, clearly. So another point in spinal cord, we have length of spinal cord 45 centimeter and weight of spinal cord is 30 grams, clearly. So this is the weight of the spinal cord and this is the length of the spinal cord. And spinal cord gives rise to 31 spinal nerves, 31 pairs of spinal nerves, clearly, pairs. Spinal cord gives rise to 31 pairs of spinal nerves. This is the introduction about the spinal cord. One more point in spinal cord, as we know, how many spinal nerves, pairs of spinal nerves, 31 pairs of spinal nerves, clearly. And how many vertebrae? We have 33 vertebrae. 33 vertebrae. So we can say that spinal segmentus do not always correspond with vertebras vertebras clearly. So our first uh, you know first that is introduction and features, first heading of the spinal cord is clear. Now we will move on to the meningeal coverings of the spinal cord. Now we will move on to the meningeal coverings of the spinal cord. This is the second heading of spinal cord. So we have number second, meningeal coverings of spinal cord. Meningeal coverings of spinal cord. Let's begin. Meningeal coverings of spinal cord. Spinal cord is covered by three meninges like brain. Spinal cord is covered by three meninges like brain. Number one, two, and three. This is the spinal cord. Clearly, the spinal cord is covered by three meninges layers: one, two, and three. Outermost layer is called as the dura mater. Clearly, middle one is called as the arachnoid matter. Innermost is known as the pia mater. Innermost is known as the pia mater. Clearly, spinal cord is covered by three meningeal layers: one, two, and three. Clearly, a space between the dura mater and arachnoid matter is known as subdural space. The space between the arachnoid matter and pia mater is known as subarachnoid space. Subarachnoid space. This subarachnoid space contains CSF. This subarachnoid space contains CSF. Outside of the dura mater is bone. Clearly, bone or endosteum. So outside the dura mater is bone or endosteum. Endosteal layer of bone. Clearly, and the space between the dura mater and the bone or the endosteal layer is known as the epidural space. Epidural space. This epidural space is important because we give epidural anesthesia in this space. Epidural anesthesia. Anesthesia. So these are the three layers, three meningeal layers that cover the spinal cord. If we see, if we consider this as spinal cord clearly, and we cut it, so we have a transverse cross section of spinal cord. First layer that we will see will be dura mater. So what is it? This is the dura mater. Clearly, inside the dura mater we will see arachnoid matter. Clearly, so this is the arachnoid matter. Clearly, so what is this? This is the arachnoid matter, and inside the arachnoid matter we will see pia matter. This is the pia matter. Clearly, this is the pia matter. Clearly, and inside the pia matter we will have spinal cord. This is the spinal cord. Clearly, so this is the dura mater, outermost, then arachnoid matter, then pia matter. Clearly, and outside of the dura mater we have the bony layer. Bony layer. Bony layer. Clearly, and we have also the spaces. This is the space between the dura mater and the bony space, that's called the epidural space. This space between the dura mater and arachnoid matter is subdural space, and between the arachnoid matter and the pia mater this space is known as subarachnoid space. Clearly, so subarachnoid space, subdural space, and we have the epidural space. Clearly, so these are the meningeal coverings of the spinal cord. So far is clear. Moving on, this layer, innermost meningeal layer, that's the pia mater, it has certain modifications. More precisely, it has three modifications. What are those modifications for? Those modifications are to keep spinal cord in position. These modifications keep spinal cord in position. Clearly, when vertebral column moves. When vertebral column moves, we do different movements, and as a result vertebral column has to move, but the spinal cord has to be in position. It is done by the pia mater modifications. So modifications of pia mater is to keep spinal cord in position during the movement of vertebral column. These modifications are of three types. Clearly, there are three modifications seen in pia mater. Clearly, number first we have here is called as the terminal phylum terminal. Number second is known as linea splendens, and number third we have ligamenta denticulata. Ligamenta denticulata. Denticulata. Clearly, these are the three modifications of the pia mater. These are the three modifications of the pia mater. Phylum terminale, linea splendens, ligament identiculator. They keep spinal cord in position when vertebral column moves. Clearly, so meningeal coverings of spinal cord, we have three coverings: dura mater, arachnoid mater, pia mater. This pia mater has three modifications. These are the three modifications. Now we will study these three modifications. Number first modification is phylum terminale. Phylum terminale. Now let's talk about phylum terminale. Phylum terminale, very important. Phylum terminale. Clearly, before we study phylum terminale, we should know all the vertebrae. We have C1 to C7 vertebrae. These are cervical vertebrae. I'm talking about vertebrae of vertebral column. Then we have here the T1 to T12. Clearly, thoracic vertebrae. Then we have here the lumbar. Lumbar are 5. 1, 2, 3, 4, and 5. Clearly. Then we have the sacral. Sacral 5 as well. 1 to 5. S1, S2, S3, S4, and S5, and we have coccyx 4, that is C1 to C4. Clearly, C1 to C4. Total, these are 33 vertebrae. Total, these are 33 vertebrae. Clearly, so far it's clear. And clearly, phylum terminale. We know from C1 to L1 that is the extension of spinal cord. C1 to L1, that is the extension of spinal cord. Clearly, C1 to L1 is the extension of spinal cord. Phylum terminale, we know it is a modification of pia mater. Modification of pia mater. Modification of pia mater. Modification of pia mater. So far is clear. This phylum terminale extends from L1 to coccyx. Where is L1? Clearly, it is here. L1 to coccyx. Clearly, this is phylum terminale. Phylum terminale. L1 to coccyx. Phylum terminale extends from L1 to coccyx. L1 to coccyx. So spinal cord ends from L1, C1 to L1, that is the adult level. Then phylum terminale extends from L1 to coccyx. Clearly, so far is clear. Another membrane that we talked about was the arachnoid membrane. That was the second membrane, middle membrane, arachnoid membrane. Clearly, it ends at the lower border of S2. It extends from C1, lower border of S2 here. Clearly, S2. This is the extent of arachnoid membrane. Clearly, arachnoid membrane, as well as arachnoid subarachnoid space. Clearly, so arachnoid membrane as well as subarachnoid space extends from C1 to S2. C1 to S2 level. Clearly, this is the extent of the subarachnoid membrane as well as this arachnoid membrane as well as subarachnoid space. Clearly, this arachnoid membrane as well as subarachnoid space, it divides phylum terminale into two parts. Phylum terminale into two parts. Phylum terminale into two parts. Number first is known as phylum terminale internum. Internum. Another one is known as phylum terminale externum. Phylum terminale externum. Clearly, externum. So, what is phylum terminale internum and phylum terminale externum? This phylum terminale internum, it is 15 centimeter length. Clearly, this phylum terminale externum is 5 centimeter in length. So, total phylum terminale is 20 centimeter in length. Clearly, 20 centimeter in length. Phylum terminale internum, phylum terminale, we know phylum terminale, it extends from L1 to coccyx. That's here. L1 to coccyx. It extends from L1 to coccyx. But the part from L1 to S2, is called phylum terminale internum, and the part from S2 to coccyx is known as phylum terminale externum. Clearly, why up to the level of S2? Because of the arachnoid membrane. It is from C1 to S2. Clearly, so this part of phylum terminale is known as phylum terminale internum, up the arachnoid membrane, and this part from S2 to the coccyx is known as phylum terminale externum. Clearly, so what is phylum terminale internum? It is inside arachnoid membrane. It's inside arachnoid membrane. As we know, arachnoid membrane extends from C1 to S2. Clearly, phylum terminale starts from L1 up to the S2 is phylum terminale internum inside arachnoid membrane, and S2 to coccyx is outside the arachnoid membrane. This phylum terminale is known as phylum terminale externum. Clearly, so phylum terminale externum is below S2. Below S2. Clearly, it is outside arachnoid membrane because arachnoid membrane ends at S2. Clearly, outside arachnoid membrane. Arachnoid membrane. So this is what we talk about the phylum terminale. That is the first modification of the pia. Now we will move on to the another modification of the pia, that is known as ligamenta denticulata. Ligamenta denticulata. Denticulata. What is ligamenta denticulata? Clearly, it is also the modification of pia. So it's modification of pia. As we know, it's modification of pia. Clearly, these are teeth-like projections. Clearly, these are teeth-like projections. Teeth-like projections. Total 21 pairs. Total projections are these teeth-like projection. Total are 21 pairs, and the last one is seen at the level of T12 to L1. This is the last projection. Last projection. So ligamenta denticulata. These are the modifications of the pia. These are teeth-like projections. Total are 21 pairs, and last projection, this teeth-like projection is seen at the level of T12L1. So where is T12L1? This is T12L1 at here. Clearly, here T12L1. Clearly. So moving forward. Now we will draw the diagram of the ligamenta denticulata. First, we will draw spinal cord. Consider this as pia, and inside the pia we have the spinal cord like this. Clearly, more appropriately, this is like this in this way. Clearly, so inside this is the spinal cord. Clearly, from here uh, goes one root, and from here goes another root. Clearly, so this is spinal cord. This root is known as dorsal root. This root is known as ventral root. Clearly, so what is this root? This is dorsal root, and this is known as ventral root. Clearly, ventral root. This dorsal root, because it's on the dorsal side of the spinal cord, and this is the ventral side of the spinal cord, anterior, posterior or dorsal. Clearly, so this dorsal root and ventral root join to form a spinal nerve. There's a different issue here, but we are talking about the ligamenta denticulata. This ligamenta denticulata is here. This is the ligamenta denticulata here. Similarly, on the other side, clearly, we will make a dorsal and ventral root. Clearly, so this is ligamenta denticulata. Ligamenta denticulata. This ligamenta denticulata is important for neurosurgeon. Is important for neurosurgery. Neurosurgeon. This ligamenta denticulata is important for neurosurgeon. Why is it important for neurosurgeon? Because behind ligamenta denticulata is dorsal root, and in front of ligamenta denticulata is ventral root. Clearly, because behind ligamenta denticulata it is dorsal root, and in front ligamenta denticulata is ventral root. Clearly, so this ligamenta denticulata helps neurosurgeon to identify where is dorsal root, where is ventral root. So it is important for neurosurgery. For a neurosurgeon, it's an important landmark. This ligamenta denticulata is an important landmark because it tells neurosurgeon where is the position of the dorsal root and ventral root of the spinal cord. Clearly, so far is clear. This is the spinal cord I made. This is ligamenta denticulata. Behind the ligamenta denticulata is the dorsal root, and in front of the ligamenta denticulata is a ventral root. Clearly, that is why it is important for neurosurgeon, an important landmark for neurosurgeon. But what is ligamenta denticulata? It is a modification of pia. It's a modification of pia. Clearly, so uh, clearly, modification of the pia. So we talked about these three modifications. We talked about phylum terminale, modifications of the pia, linea splendens is not so important, and ligamenta denticulata. So these are the three modifications of the pia. That is the third meningeal layer of spinal cord. Clearly, so far we completed introduction and features of the spinal cord and meningeal coverings of the spinal cord. Now we will move on to the enlargements of the spinal cord, and columnus medullaris and cauda equina. Clearly, now we have enlargements of spinal cord. Enlargements of spinal cord. Clearly, we know, consider this as spinal cord. It has two enlargement. Number first enlargement. This is the first enlargement, and similarly there is a second enlargement. Clearly, this is the spinal cord. This enlargement and this enlargement. This upper enlargement, it is known as cervical enlargement. This is cervical enlargement. Cervical enlargement, and the lower enlargement is known as lumbar enlargement. This is cervical enlargement. This is lumbar enlargement. Clearly, this is lumbar enlargement. Clearly, this cervical enlargement supplies. It is for the supply of upper limb muscles. Upper limb muscles. Clearly, lumbar enlargement is for the supply of lower limb muscles. Clearly, this extends from C4 to T2 spinal segment. This extends from L3 to S3 segments. Clearly, so what is this? This is from C4 to T2. Clearly, this is from L3 to S3. Clearly, S3. Clearly, so these are the two enlargements of the spinal cord. Cervical enlargement, that is for the supply of upper limb muscles, and lumbar enlargement for the supply of lower limb muscles. These are the segmental level. Clearly, so enlargements of the spinal are clear. So the enlargements of the spinal cord are clear. Now we will move on to the last topic, that's conus medullaris. Conus medullaris, conus medullaris, and cauda equina. And cauda equina. What is conus medullaris? Conus medullaris is lower tapering end of spinal cord. Lower tapering end of spinal cord. Clearly, what is cauda equina? Cauda equina, it is a bunch. It is a bunch of spinal nerves. It's a bunch of spinal nerves. Clearly, from L2 to coccyx. From L2 to coccyx. Clearly, so this is the conus medullaris, and this is cauda equina. Clearly, in conus medullaris syndrome, if there is if conus medullaris is affected, clearly the nerves that are affected are sacral and coccygeal. Sacral and coccygeal nerves. Clearly, if conus medullaris is affected, the nerves arising from it are affected. Those nerves are sacral and coccygeal nerves. Clearly, are affected. Clearly. Similarly, if in cauda equina syndrome, if cauda equina is affected, clearly lumbar as well as sacral as well as coccygeal nerves are affected. Coccygeal nerves are affected. Are affected. Clearly, so this is the difference between this is we talked about the conus medullaris and cauda equina. So we completed first four headings. We completed the first four headings of the spinal cord. That's the introduction and features, then meningeal coverings of spinal cord, then enlargements of spinal cord, and conus medullaris and cauda equina. Clearly, in the next video, we will talk about the next three. That is the external features, internal structure, and clinical anatomy of the spinal cord. Clearly, so this is the video first of the playlist of the spinal cord. One last point that is very very important that you should know about is about the uh, dura mater. Clearly, is about the dura mater. That is the outermost meningeal layer of spinal cord. This dura mater, it is single layer in spinal cord. Is single layer in spinal cord. Clearly, while as in it is double layer in brain. Clearly, when this dura mater covers the brain, it is double layer, but when it covers the spinal cord, it is single layer. So cranial dura is double layer, while as spinal dura is single layer. This is all about the spinal cord. Thank you very much. Your Dr. Oogway here.